Hello, everyone. Thank you all so much for coming out tonight, especially with the weather that we're having. I'm Rory Linane, and I'm one of the reporters on the Kids in Crisis series from USA Today Network Wisconsin, which you may have seen in the Fond du Lac Reporter. So it was through the reporting that we've been doing on this series over the past to give you all tools to look out for each other and empower you to do something about this in your communities. So later this evening we'll have Sharon Stoffel. She does the Y screen for Fond du Lac schools, and she will be facilitating the QPR training. But before we get to that, I want to tell you all a little bit more about the Kids in Crisis series, and then you will also hear from some local advocates about what's happening in Fond du Lac around mental health. And then we'll have the training, and afterward we encourage you to stick around to look at some of the great information we have here from local organizations and talk with each other. So the Kids in Crisis series began early last year. It started off with the Wessner family here from central Wisconsin. They lost their son, Jonathan, to suicide, and they decided that they didn't want to see any more parents going through what they went through, and became really fierce advocates around that subject, and a big part of our series. After we ran that story, we were really surprised to see how many more families really came out of the woodwork and were willing to share their stories with us, with the same hope that others would not have to go through this. I want to show you, this is a video of our first year.
USA Today Network Wisconsin's series of teen suicide started with one brave family's story. The Kids in Crisis project grew into a movement, with families and experts around the state joining our call to better support struggling youth.
In honor of my daughter Morgan, I will continue to help in any way that I can because it's what she would want me to do.
Our series has involved 44 stories, but it is not confined to the pages of the newspaper. We held 10 town hall meetings throughout the state, with more than 800 people who brought more than 200 questions. We proposed 5 solutions to teen suicide and made one pledge for change, which we took to the state capitol in a call to action event. Our series was recognized by Pointer for its engaging approach. But what really makes us proud is that the work is valued by our communities and the people who shared their stories with us.
We'd like to thank USA Today, along with Jim, Rory, and Liz, for taking the series of Kids in Crisis to the next level. Now let's start saving our children.
So this whole series wouldn't be possible without the underwriting of Bellin Health. And tonight we have Sharla Beynon here from Bellin, who would like to say a few words to you.
Thank you, Rory, and thank you, USA Today Network, again, for investing your time and energy for year 2 of Kids in Crisis. We saw such benefit in our communities around the state in creating more awareness and really starting to have those conversations that we should have been having for a long time. So I'm very excited to be able to support this initiative again this year and have Bellin provide the underwriting support. I'm very excited to see a good turnout tonight. You guys are the inaugural year 2 event here in Fond du Lac, so thanks for coming. And this is obviously one excellent training that provides you with some skills to know how to respond, at least when you are working in your communities and just really spending time with each other, because we have to realize that folks interface in their community, and you're a lot of time the first line of support before they ever make it to primary care, to mental health providers. So very key for us to continue to educate in our communities. In Brown County, I have the opportunity actually through our local coalition there to help support QPR training too. And we've trained almost 20,000 in our community in Brown County. So we're very excited about that and have set some pretty great goals on that. So I think this is a great opportunity and a perfect segue into year 2 of Kids in Crisis to educate our communities and really to empower you with information and tools so you know how to respond. So thank you again. Thanks for doing this and being here and committing the time.
All right, thank you, Sharla. So as we went through our reporting, we started out by finding some really troubling numbers. We saw just how many youth out there are dealing with depression and other mental health challenges and how uncommon it is for them to actually get treatment and get help for that. We found out that there are severe psychiatrist shortages, particularly those who can work with children in Wisconsin. And also shortages of staff in our school districts. We fall far below the recommended levels of social workers, psychologists, counselors, and nurses that are recommended to have in our schools. And then we looked for some solutions, and we found a lot of psychiatrists out there who are using video chatting in order to reach people that otherwise wouldn't be able to access help. We found doctors who were, for the first time, learning about mental health and trying to help their patients with these issues. And most inspiring, we found young people who were willing to share their stories far and wide and break the stigma around mental illness. And then we put together an editorial where that was based on these solutions that we had heard from advocates all throughout the state. We held a call to action event in Madison. And we asked people all around the state, including lawmakers, to sign this pledge to actually make changes. And now we're seeing them. We recently had the state superintendent came out with a plan to address mental health that was based closely on the editorial that we put out. It would allow for clinics in schools and hiring more social workers in schools throughout the state. And then Governor Walker included those same proposals in his budget proposal. And so we will be following that as it works its way through the legislature. And this video might not be working. So as we head into year 2, there are a lot of ways you can stay involved. You probably saw outside that you could sign up for our newsletter to get some ongoing coverage. If you missed that, you can sign up after. And we are also always looking for people to share their stories with us. You can write something and send it in, or you can participate in this video contest that we're having. And if you signed up for the newsletter, you'll be getting more information about that. So next we're going to hear from some other people in the audience tonight. First, we have Rob Kaminsky. He works with the Office of Children's Mental Health.
Thank you, Rory. Yes, that's my daughter up there, and she's sitting right here. Yes, I actually partner with the Office of Children's Mental Health. The Office of Children's Mental Health came into establishment about 2 years ago. It is a backbone organization for collective impact. And collective impact really is all the different divisions that you have in the state, the Department of Health Services, the Division of Children and Family, DPI, they all had this common agenda of wanting to help children and seeing that there's a lot of mental health challenges out there. So the Office of Children's Mental Health came into creation as a backbone organization to start this collective impact. In other words, to get this common agenda on the table. Let's bring everybody together. Let's share our measures. Let's communicate in a way, and we do communicate with every other month. Everybody gets together. Every month, we get together as collective impact partners. Now, what a collective impact partner is, what I am, we try to keep at least 10 parents with lived experience on the board. And there's information out back. If you'd like to be a parent or something, please give us a call. We also, to really keep the experience true, we also want to have at least 5 collective impact youth. My daughter is one of them, and we have 2 other very active youth that's also on the board. The whole idea is we can't have collective impact and we can't make a change unless we have lived experience on the board so we can learn. And that's exactly what we're doing. We're about 2 years into the process. We are making a lot of changes. Personally, I'm a collective impact partner that sits on the DHS 40, which has to do with day treatments. We're changing the rules, the laws that go in effect with day treatments, and we're pushing that family involvement is the most important part. You have to be listening to the family as a whole, not to just, as a lot of people would say, the consumer. We also are part of the CST program, Children Come First Advocacy, which meets every other month, is it, Allison? Yeah, which covers the CST programs in the state. And then, of course, we have these opportunities here. So the whole thing is we want lived experience to be talking and communicating with these departments. So if this is something that you're really passionate about, please meet with me afterwards at the back table. We'll get you the information. We'll try to get you involved, and we are going to keep pushing collective impact for a huge change. Thank you.
Thank you, Rob. Next, we have Allison Wolf, who works with an organization called Wisconsin Family Ties.
We have such a nice new logo compared to that thing, but you don't know about that, so. So Wisconsin Family Ties is actually in its 30th year. This is our 30th year. Everyone who works for our organization is a parent who has one or more children with a social, emotional, or behavioral challenge. We mainly work with families who've got children with mental health challenges, because social, emotional, behavioral usually is a nice umbrella. We are called Parent Peer Specialists. We are state-run, so we're across the whole entire state of Wisconsin, and we walk alongside you. There are brochures back there. Office of Children's Mental Health and Wisconsin Family Ties are sharing a table. We partner a lot together. I also am a parent partner on the Office of Children's Mental Health committee as well with Rob, and you can get our brochure, and my business card is back there. There's no cost to parents. We partner with counties and look for other grants and other opportunities so that we're able to help walk alongside you with advocacy, referral. If we can give you someone in person to help with challenges you're having, we will. Otherwise, we help over the phone and via email, and we really are there to really help answer questions. I'll be around too to help with anything you might like. We are on Facebook, and though Facebook sometimes can be a little fluff, I like the fluff, but if you want to look and join like our page, we have a policy director who really puts timely information. She's looking at all that stuff that's out there and really puts real pertinent, current information out there for you. So I think you might find that very helpful. You also can ask questions there too privately, and we can get back to you as well. Everything you share with us is completely confidential, and I'd be happy to talk with any of you afterwards if you'd like and share a little bit more with you about Wisconsin Family Ties. I also am a youth mental health first aid trainer through DPI's Project Aware grant, and if any of your communities or anybody you might know or your school might want to have a training, that is an active grant going on right now that we can probably offer that training free. It is 8 hours, so that wouldn't be everything we could do at one of these trainings, but it's youth mental health first aid. And Tony Evers, that's one of the things he's really put forth, trying to get more people trained in the state of Wisconsin. It's great for anyone who interacts with youth and adolescents. So if you want to talk to me about that as well, thanks.
Thank you, Allison. Now we have Amanda Schultz. She's with the Center for Suicide Awareness, which operates the Hope Line, which is a great text-in Hope Line.
How is everybody? Good. How many of you have heard of the Hope Line? Okay, so some of you. The Hope Line, we have been active for about 3 years now. We are 24/7, 365. The Hope Line is not just for suicide prevention, but it's also for emotional assistance. You're having a bad day, there's a breakup. It's really there for people to get some help with their issues that are going on. We have a lot of youth that text in. The nice thing about Hope Line, it's anonymous. So you don't have to give us your name. You don't have to tell us where you're from. And we have found that through the statistics, we have a lot of youth with, breakups and bad days in school. Bullying is huge. And we also have licensed workers on the Hope Line. So if somebody doesn't feel comfortable talking with one of our 1,700 volunteers, we do have licensed workers on the Hope Line. We have also reached over through Canada and Mexico borders to help with sex trafficking and human trafficking that has been prevalent. We have been successful with 2 sex trafficking cases now since we have started that. So we're really proud that we have done that and that we're being involved with helping people trying to, break away from these people and be safe. I guess that's all I have.
Thank you. And finally, I have Chris Saha. She's been part of our series since last year when we did these first town hall meetings. And she lost her daughter, Morgan Piper, to suicide. And she's here to talk to you tonight. Thank you so much for coming.
Everybody else went so fast, I'm not really sure that I'm going to be that quick. But anyway. All right. So I want to start by telling you about my daughter, Morgan. Morgan died by suicide on June 25th, 2015 at the age of 15. To be exact, she was 15 years, 2 months, and 6 days. Morgan's short life impacted many people, but mostly it impacted mine. Morgan was an incredibly sensitive and kind soul. She seemed to have the ability to read people and knew who needed an ear to listen, a hand to hold, or her favorite thing, a hug. I often think about all the things that made her unique. One of the things that comes to mind now as I reflect on her life is her bravery. Bravery for fighting a battle I knew very little about. Bravery for facing her demons for as long as she could. I believe she kept as much as she could inside until it became intolerable, and in her mind, fatal. As I go back through every detail of the weeks and months leading up to her death, I search for answers. One of the things that becomes very apparent after death by suicide is accepting the fact that you won't have all the answers. You'll have a puzzle, but you'll never have all the pieces. What I have learned may help others, so I share our story. Here's what I'd like you all to know. Suicide doesn't discriminate. It knows no boundaries of race, socioeconomic status, intelligence, age, or gender. Morgan was a straight-A student with lots of friends. She had goals and plans and dreamt of becoming a marine biologist. She was beautiful with an infectious laugh and a smile that lit up a room. What I didn't see was her sadness. She was moody, as many teenagers are from time to time, but never mouthy or disrespectful or rude. Her teachers told me she was a pleasure to have in class. Her principal and guidance counselor from her school said she wasn't even a kid they would have put on the radar. And I suppose if there's teachers or guidance counselors in this room, you know what that means. Socially withdrawn? Nope. Poor academic standing? No. Drug abuse? No. Bullying? No. Self-harm? Yes. Morgan was a cutter. She was cutting herself in 8th grade. I took her to a counselor with over 20 years of experience with children. After many, many sessions, he reassured me that she was okay. He had no major concerns. They talked about alternative coping mechanisms and ways to deal with stress, and it stopped. I would learn later that she began cutting herself again weeks before her death. Her moods the last few weeks of her life seemed to fluctuate more, so I made an appointment with her primary care provider. Sadly, she took her life the night before her appointment. When a suicide occurs, personal property is fair game for detectives. In my case, I was fine with giving up her phone and her computer because detectives would be able to extract files and things that I would never find. These searches revealed that Morgan was communicating on social media sites, Kik and Instagram, about her plans. She made her plans known to 2 boys. Those boys told her that they loved her. They tried to talk her out of it, but they never told an adult. Tragically, her peers liked her posts and commented, but again, never told anybody. I was not aware of the fact that she was on Instagram because she used an alias. I would have never found her. Kik is a communication site where evil runs rampant without accountability or consequence for what is posted. The messages shared disappear within minutes of being read, so a parent would really have no way to track what exactly is going on those sites. If only I had known about these sites. Oh God, the if onlys. Mental illness carries a stigma. Is that why Morgan hid her struggles? Life for adolescents today is anything but easy. We live in a world of hyper-connectedness, which you would think would be a good thing. The reality is, it isn't. Studies have shown that loneliness, in spite of hyper-connectedness, is killing us. We are connected to others, but not in ways that truly make us feel less alone. I'm a nurse and have worked with chronically and acutely mentally ill patients. That's an irony I have to live with. My daughter was struggling and I didn't see the signs. I didn't realize how hopeless she felt. I believe her suicide was the end result in the perfect storm. Impulsive? Absolutely, but permanent nonetheless. What can we do? I do want to talk about the Hope Line. I presented in the Dells in November with Barb Bagelke about this Hope Line, and I truly believe that had my daughter known that that line existed, she at least possibly would have reached out to somebody that was trained on the other end of a text message, not just her friends. So thank you, Amanda, for speaking about that, and your yellow shirt did not go unnoticed. That is actually suicide awareness color. Can mental health discussions be built into curriculum starting in elementary school? Perhaps this would help normalize discussions about mental health issues. Will anonymous surveys in schools help? These kids are talking to each other through social media sites or in person, but not to adults who can help them. Adolescents care deeply for one another, but are not equipped to handle mental health issues in peers. Can we work to build better trusting relationships with them through peer support groups? Do we as adults look at the world in a way that prevents us from seeing the realities these kids really face? Did we paint an unrealistic picture that life is wonderful all the time? When the reality of life's shitstorms hit them with blinding force, are they ill-equipped to handle them? Can we teach them to better navigate the storms? Morgan didn't fit the statistics that make her an at-risk teen. She was beautiful, sensitive, and kind beyond measure. She was the absolute best of me. Please remember, Morgan, don't look with judgment or preconceived notions. Please help me spread the word that these kids that we are here for them through life's storms, that they are beautiful and matter so much to so many. And maybe, just maybe, we could all spread a little more kindness. I know when I do, I feel Morgan smiling down on me. Thank you.
Thank you so much, Chris, for sharing. And now we're going to head into the QPR portion. We have Sharon Stoffel here to guide you through that. Can we take this off?
Great, thank you. Hello, everybody. I am going to talk tonight about, do the QPR training, but I'm also going to talk about Yscreen and some local programs and resources that are available here in Fond du Lac County. And we have a lot of them. And so I think a lot of times, though, people aren't aware of them. The ones that everybody's talked about are wonderful. We have the Hope Line on our resource card that we give to students, and we tried it out. You know, we let them know we were just trying it out, and it works great. It's a wonderful way to communicate. I may not look like it, but I have 2 teenage boys, and they don't communicate by phone or by email, or they communicate by text. That's the way to communicate. So I've gotten really good at texting as well. So I think things like the Hope Line are really important resources for people. Anyone here hear of Y-Screen at all? Okay, excellent. So I'm going to start by talking about Y-Screen. And I'm going to get out of the way a little bit. I don't know if you guys can see. Oh, that's right. I forgot that. So Y-Screen is an emotional health screen that is offered to all freshmen in Fond du Lac County. And it's at all the high schools, public and private, and started at Fond du Lac High in 2002. So we have been there a long time. We also offer, Y-Screen is also offered through Agnesian Healthcare, through the pediatrics department. So if your child goes in for a wellness check, 6th grade and up, they should be offered Y-Screen as well. If they aren't offered it, ask for it. So we also go through juvenile court services as well. We do screening in that population too. We were the first city, the first high school in Wisconsin to offer an emotional health screen for youth. And basically, Y-Screen started out as Teen Screen and then is now changed to Y-Screen. But the reason it was started was a suicide prevention program. In their research, they found there had to be some way to have some predictors for suicide. And they did studies and found that there are warning signs. It's just that it's not normal conversation. It's not something you ask people on a regular basis. So they came up with a screening tool to be able to ask youth, because again, they aren't going to come to you many times with the issues that are going on. So you don't directly ask them about it. It's not necessarily breakfast conversation or dinner conversation, but we do ask them directly about suicide. And it's amazing to me how many kids are relieved to be able to talk about it, that someone has actually asked them those questions. Since we started, we have screened over 10,500 students, which is about 60% of the students that it's offered to, because we do need parent permission in order to do the screening. So not everybody who's offered it takes it. But 60% is far above the national average, which is about 30% participation rate. So Fond du Lac County is very progressive in that area. We've referred over 1,900, which is about 18% of those we screen, which is about the national rate. The national rate of referral is 20%. So that's why people always say, well, don't kids lie on this? And I'm sure some do. But because our statistics match the national statistics, we're feeling that kids are pretty honest about it. And then we've connected over 1,000 students, or 55% students, to services, and that's in the past, what would that be, 15 years, almost 15 years. That number is one we're trying to increase. We would love to see 100% of the students connected to services. But, whoops, it's not due to the lack of services. Now, you may not be able to get in to see someone the next day, but there are a lot of services in Fond du Lac County. I have never, in about the 13 years I've been doing Y-Screen, I have never said to a parent or a student, there's nothing here for you. There's nothing that we can get help for. We are work with people. So we make sure that people can get connected to services. I don't think it's going to stay. There we go. I'll put it this way. There we go. There we go. Especially at Fondi High, it's become a normal part of freshman health. Everybody just expects that this is what you're going to be offered and this is what you should do during freshman health. The teachers are the biggest advocates. They encourage the kids to take the screen. They've taken it themselves. They know what it's about. They share personal stories that about mental health issues, so that it really encouraged students to take the screen. Y-Screen is staffed by experienced professionals. I've been in the mental health field for 35 years, and everybody I work with has equal amount of experience. So we have been doing it for a long time. We are funded through United Way, through Agnesian Healthcare, and Wisconsin Partnership Program. So we get grants to help fund us. It's not part of the school district budget at all. And the schools we go into, nobody pays for our services. At this point, we're still able to offer it all for free. It's a community-based program. We have the support of schools, mental health professionals, businesses, and primary care providers. So it's the whole community helping with us to make this program successful. It has to be the whole community being a part of that. These are just some statistics. Suicide is the second leading cause of death among adolescents in Wisconsin versus third in the nation. So unfortunately, Wisconsin is at higher risk. Just living here, you're at higher risk for suicide. And I believe the first leading cause of death is accident, which there is always some, not sure if some of those accidents are also suicide. So 16% of students surveyed in Wisconsin in 2014 seriously considered suicide in the past 12 months. This is the anonymous health survey that you were talking about that is done on a statewide, but is also done locally. And I'll show you the results of the Fond du Lac School District screen. We do it, or the survey we do every year. 8% of the youth have attempted suicide. So that is a lot. It shows, too, if you're thinking about it and seriously considering it, there is obviously a high risk that you may attempt. And 1 person per week dies by suicide in Wisconsin. It is an issue. It's not something that somebody isn't touched by. In Fond du Lac, the 2016 School District Student Health Survey found that 17% of those surveyed reported seriously considering suicide. Now, this is a decrease from 26% in 2004. That's when it was at its highest. So it's definitely improved, and I think programs like Y-Screen, things like the Hope Line, all of those types of things definitely help, or some of the things that other people have talked about. 6% of those surveyed reported attempting reported attempting suicide. That number percentage has pretty much stayed the same over the course of the survey. There were 13 suicides in Fond du Lac County in 2015, and that's all ages. I'm not sure if there were adolescent in 2015 compared to 4 homicides. So again, it's an issue. It's an issue locally. It's not just something that's out there. And then we have something called CSI, which is not what everybody would think it would be. It's Comprehensive Services Integration, and that's been going on for quite a few years in Fond du Lac County. And again, their main goal is to provide services and make sure youth in our community are helped emotionally, behaviorally, in many different ways. And Healthy 2020 Mental Health Access Committee is also active to help improve the access to mental health services, because that is an issue. I think Rory brought that up, that finding that there aren't a lot of psychiatrists, that type of thing. So it's definitely something that the community is beginning to work at. Also new in the last couple of years is the high school, Fond du Lac School District, but mainly just at the high school at this point, is working with Agnesian, and they provide a PhD intern to the high school who comes to the high school and provides therapy in the high school at no cost. So that if there are concerns about barriers with cost, insurance, travel, that type of thing, we have someone in the high school who comes 2 days a week to provide therapy. So that is a really exciting thing that we have utilized a lot already in just the last 2 years. All right. So I think this is where we have to cut the live streaming. Part of it is QPR.